Have you ever felt a sudden, sharp pain so intense you thought something was terribly wrong? For many people, this is the first terrifying sign of a kidney stone, which is a hard mineral deposit that can cause severe and sudden symptoms. Recognizing these warning signs early can help you avoid complications. If you suspect you might have kidney stones, understanding the most common symptoms is crucial for seeking prompt medical advice and finding relief. Number 1. Severe pain in the side, back, or abdomen. The most classic and often the most alarming symptom of a kidney stone is a sudden onset of severe pain. This isn't a dull ache that gradually gets worse. Instead, it's typically a sharp, cramping, and excruciating pain that can appear without any warning. In fact, many people who have experienced both childbirth and kidney stones describe the pain of a kidney stone as being significantly worse, which really highlights its extreme intensity. This discomfort, known as renal colic, happens as the stone begins its journey out of the kidney and into the narrow tube called the ureter, causing a blockage and a buildup of pressure. This intense pain is often located in the flank, which is that area on either side of your back, just below the rib cage. The pain isn't stationary, though. As the kidney stone moves through your urinary tract, the location and the nature of the pain can shift. It frequently radiates downward, moving from your side and back toward the lower abdomen and into the groin area. In men, this pain can sometimes be felt directly in the testicles, which can be particularly distressing and confusing if you don't understand the root cause. One of the challenging things about kidney stone pain is its intermittent nature. The pain isn't constant, but rather comes in waves, fluctuating in intensity. You might experience periods of agonizing pain lasting from 20 minutes to an hour, followed by a temporary lull where the pain subsides or disappears completely. This happens because the ureter is contracting to push the stone along. These waves of pain correspond to the muscle spasms trying to move the stone forward, which is why the sensation can be so unpredictable. This fluctuating pattern can make you second guess what's happening, but it's a hallmark sign of a kidney stone on the move. The intensity can change from one moment to the next, shifting from a manageable ache to overwhelming pain that makes it impossible to sit still or find a comfortable position. If you're experiencing this type of severe wave-like pain, it's a strong indicator that a kidney stone may be the cause. But while pain is a primary indicator, it often brings other unwelcome symptoms with it, especially related to your urinary habits. So, let's explore how kidney stones can dramatically alter your trips to the restroom. Number 2, changes in urination. Another significant sign that you may be dealing with a kidney stone is a noticeable change in your urination patterns. As the stone travels closer to your bladder, it can irritate the bladder wall and create a persistent, urgent need to urinate. You might feel like you have to go to the bathroom far more frequently than usual, even if you've just been. This can be disruptive during both the day and night, yet when you do try to urinate, you may find that only a small amount of urine comes out. In addition to that increased frequency, the act of urination itself can become painful. This symptom, known as dysuria, is often described as a sharp, burning sensation. The discomfort happens as the stone irritates the lining of the urinary tract, or as your body works to pass the stone through the urethra. This burning feeling can be easily confused with a urinary tract infection, but when it accompanies the severe back or side pain that's so characteristic of kidney stones, it provides another important clue about what's going on inside your body. In some cases, a kidney stone can become large enough to partially or even completely block the flow of urine. You might notice that your urine stream is weaker than normal, or you may have to strain to urinate. If the stone causes a complete obstruction, you might find that you are unable to urinate at all. This is a very serious situation and is considered a medical emergency. A total blockage can cause urine to back up into the kidneys, leading to significant pain, swelling, and potential kidney damage. If you find you can't pass urine, you must seek immediate medical help. Perhaps one of the most visible and alarming urinary changes is the presence of blood in the urine, a condition called hematuria. The sharp edges of a kidney stone can scrape the delicate lining of the ureter as it moves, which causes bleeding. This can turn your urine a different color, ranging from light pink to red, or even a dark brownish hue similar to cola. Sometimes the amount of blood is so small that it isn't visible to the naked eye and can only be detected with a urine test, but any visible discoloration is a clear signal to see a healthcare provider. These urinary changes are directly linked to the stone's journey, but the body's reaction to this internal stress can show up in other ways, particularly by affecting your digestive system. Number 3, nausea and vomiting. When your body is under the immense stress of a kidney stone, it's very common to experience significant nausea and, in many cases, vomiting. This gastrointestinal distress might seem unrelated to a problem in your kidneys, but there's actually a clear physiological connection. The kidneys and the gastrointestinal tract share common nerve pathways. So, when a kidney stone causes a blockage and sends out intense pain signals, these nerves become overstimulated, triggering a reflex reaction in your digestive system that leads to feelings of nausea. This response is also closely tied to the sheer intensity of the pain itself. Severe pain, no matter where it comes from, can overwhelm the body and trigger a systemic response that includes nausea and vomiting. For those experiencing the excruciating, wave-like pain of renal colic, the feeling of sickness can be just as debilitating as the pain. It's really the body's way of reacting to extreme physical distress. Having nausea and vomiting alongside the characteristic side or back pain greatly strengthens the likelihood that a kidney stone is the underlying issue. The timing of these symptoms can also be revealing. Nausea often gets more intense as the waves of pain reach their peak, making it difficult to keep any food or fluids down. This can lead to dehydration, which is particularly concerning because staying well hydrated is one of the most important steps in helping to pass a kidney stone. Dehydration can make the urine more concentrated, potentially making it harder for the stone to move and even contributing to the formation of new stones. Therefore, managing nausea isn't just about comfort, it's a critical part of your immediate care. When you go to a doctor with severe abdominal or flank pain, one of the first questions they'll likely ask is whether you've also experienced nausea or vomiting. The combination of these symptoms creates a classic clinical picture of kidney stones. It signals that the body is in a state of acute distress, often requiring medical intervention not only to manage the pain, but also to address the accompanying gastrointestinal symptoms and prevent dehydration. Now, beyond pain and nausea, your body has another way of signaling that something is seriously wrong, especially if an infection has developed. Number 4, fever and chills. While symptoms like pain and nausea are direct results of the stone itself, the onset of fever and chills points to a more serious complication, an infection. A kidney stone can block the ureter, which is the tube that carries urine from the kidney to the bladder. When urine can't drain properly, it can stagnate and back up into the kidney, creating an ideal environment for bacteria to grow. This can lead to a urinary tract infection, or more seriously, a kidney infection known as pyelonephritis. A developing infection often announces itself with a fever, which is the body's natural response to fighting off harmful pathogens. You might notice your temperature rising, often accompanied by chills or uncontrollable shivering as your body tries to generate more heat. You might also start sweating as your body attempts to cool itself down. These symptoms should never be ignored, as they indicate that the problem has escalated beyond simply passing a stone and has now become a systemic issue that requires urgent medical attention. The combination of kidney stone symptoms with a fever is a major red flag. If you are experiencing severe pain in your back or side, along with a high temperature, it is crucial to seek immediate medical care. An untreated infection that's complicated by a urinary blockage can quickly become life-threatening. The infection can spread from the kidney into the bloodstream, a dangerous condition known as sepsis, which requires aggressive treatment with intravenous antibiotics in a hospital setting. For that reason, you should not wait to see if a fever will resolve on its own. While pain from a small, uncomplicated kidney stone might sometimes be managed at home under a doctor's guidance, the presence of fever and chills changes the situation entirely. It transforms the condition from a painful but manageable issue into a potential medical emergency. A prompt evaluation by a healthcare professional is essential to diagnose the infection, relieve the blockage if necessary, and start the right antibiotic treatment to prevent severe complications. In addition to these systemic warnings, the appearance and scent of your urine can offer one final direct clue about trouble in your urinary tract. Number 5, cloudy or foul-smelling urine. The characteristics of your urine can provide important clues about your overall health, and this is certainly true when it comes to kidney stones. Healthy urine is typically clear and has a very mild odor. However, the presence of a kidney stone can cause distinct changes, making your urine appear cloudy or murky. This cloudiness, also known as turbid urine, can be caused by the presence of pus from an infection or by an increased concentration of minerals and crystals that the body is trying to expel. Alongside this change in appearance, you may also notice that your urine has a strong, unpleasant odor. While many factors can affect the smell of urine, a particularly foul or pungent smell can be a sign of a problem. This odor is often the result of bacteria if a urinary tract infection has developed alongside the kidney stone. The combination of concentrated waste products and bacterial activity can produce a smell that is noticeably different and more offensive than your normal urine. It's important to recognize that cloudy and foul-smelling urine are also hallmark symptoms of a standard urinary tract infection. Because of this overlap, it can sometimes be difficult to tell the difference between a simple infection and one that's complicated by a kidney stone based on these signs alone. However, when these urinary changes occur along with other key symptoms, such as severe flank pain or nausea, it makes the presence of a kidney stone much more likely. Paying attention to these changes can help you seek care sooner. The presence of cloudy or foul-smelling urine warrants a discussion with your healthcare provider, as it almost always indicates an underlying issue that needs to be addressed. Whether it's a straightforward urinary tract infection or a sign of a kidney stone, getting a proper diagnosis is the first step toward receiving the correct treatment, preventing the infection from worsening, and addressing the root cause of the problem. Risk factors for kidney stones. Several factors can increase your likelihood of developing kidney stones. A family history of kidney stones or a personal history of having them before puts you at a significantly higher risk. Dehydration is a major and preventable cause, as not drinking enough water allows stone-forming minerals to become more concentrated in your urine. Certain dietary habits also play a role. Diets high in sodium, sugar, or animal protein can elevate your risk. Beyond lifestyle, other medical factors contribute. Obesity is a known risk factor, as are certain medical conditions like diabetes, gout, and chronic diarrhea, which can alter the chemical balance of your urine. Additionally, some medications and supplements, including certain diuretics and calcium-based antacids, can promote stone formation. While you can't change your genetics, Many of these risk factors can be modified through lifestyle changes and careful management of your health. When to seek medical attention. Knowing when to seek medical help for suspected kidney stones is crucial for preventing serious complications. You should seek immediate medical evaluation if you experience severe, persistent pain that isn't relieved by over-the-counter pain medication. If this pain is accompanied by nausea and vomiting that prevent you from keeping fluids down, it's time to see a doctor. The presence of fever and chills alongside other symptoms is a major warning sign of a possible infection and requires urgent care. Furthermore, any visible blood in your urine should prompt a visit to your healthcare provider. One of the most critical situations is a complete inability to urinate. This indicates a total blockage of your urinary tract and is considered a medical emergency that requires immediate intervention to prevent kidney damage. Don't hesitate to go to an urgent care center or emergency room if you experience these severe symptoms. Prevention tips. The best way to deal with kidney stones is to prevent them from forming in the first place. The single most important prevention strategy is to stay well hydrated. Aim to drink plenty of fluids, primarily water, throughout the day to keep your urine diluted and flush out stone-forming minerals. Dietary adjustments are also key. Limit your intake of sodium, as high salt consumption can increase the amount of calcium in your urine. It's also wise to moderate your intake of added sugars and excess animal protein. Maintaining a healthy weight and managing underlying health conditions like diabetes can further reduce your risk. Finally, speak with your doctor about any medications or supplements you take, as some may contribute to stone formation. Recognizing the key symptoms of kidney stones is the first step toward getting the help you need. If you notice severe pain in your back or side, significant changes in your urination, persistent nausea, fever, or cloudy, foul-smelling urine, don't ignore these signs. Consulting your healthcare provider promptly can lead to an accurate diagnosis and effective treatment, helping you avoid complications and find relief. Found this article helpful? Share it with your friends and family to help spread awareness about the common signs of kidney stones. For more valuable health tips, be sure to subscribe. We would also love to hear from you. Leave a comment below with your questions or experiences.